Hi, I'm Dr. Tom Livermore, owner of Livermore Performance Chiropractic here in East Lansing, Michigan. What we are is a full-function chiropractic facility that offers chiropractic adjustments, therapeutic exercises, and the specialty which is active release technique or ART. Really what ART is a specialty that allows me to diagnose and treat soft tissue injuries. Whenever you hear the term soft tissue injuries, it's relating to any injury with a muscle, a tendon, the nerve or the connective tissue that basically binds everything together. Okay, the one thing that we find with soft tissue injuries is it's a common overuse injury. Okay, there's three different things that really can create scar tissue and adhesion problems, which are accumulation, hypoxia, which is just a lack of oxygen getting to the tissues, or repetitive strains, sprains, things like that. So as the tissues get bound up, we need to be able to free that up to create adequate motion. Okay, what I'm going to do, we have Dave here. Dave's going to help me demonstrate what we're going to do is working through the posterior hip capsule, some of the glute area, and that common piriformis. Okay, so to start, I'm just going to extend Dave's leg just like this. And this is what's really the unique part about ART is the fact that I use my hands to actually kind of feel through the tissues here and find where some of those nodules, adhesions, or trigger points are and slowly work through it. So as we come up here, all I'm doing is applying a little bit of tension onto that tissue. I'm essentially holding down that gluteus maximus muscle, forcing there to be a slide and glide along the other side. Okay? Then as we get deeper, we're going to get onto that piriformis muscle. I'm going to bring this knee up. I'm going to ask Dave to hold the knee down, just like that, and then drop that ankle towards the floor. I'm just adding a little bit of pressure, just like that. And once again, that's isolating, creating a good amount of tension onto that tissue, breaking up any of that scar tissue. Okay? The whole idea is if we can get rid of that scar tissue, we're going to increase the circulation to the blood flow and circulation to that tissue. We're going to increase the function and motion. Once we free up this area, that's when we can really start to get into the appropriate rehabilitative exercises. Good. And then drop that down. Fantastic. So we basically just did two motions through there. One was through the glutes, and the other was the simple piriformis and some of the posterior hip capsule. If you have any questions about active release technique or working with the hip or low back, please contact the office.